Deadly disparity in newborn survival at Kenya's county hospitals. Babies referred from one health facility are 3 times more likely to die than those born in the same hospital where they receive care. The 5-year study found that 29% of referred babies die. The research, led by Kenyan scientists along international partners, exposes critical failures in the referral system. Babies arriving severely hypothermic, struggling to breathe, and reach in hospitals dangerously late, more than 24 hours after birth. The researchers say most of the deaths are preventable. Tonight we investigate why Kenya's newborn referral system is failing and what it takes to save these lives.
On the 28th of February, Cecilia began to experience pain. She went to a health facility near her home, pregnant and already in danger.
Kufika pale wakasema pressure yangu iko juu, wakasema watanilifaa kunileta hapa Mama Lucy.
What should have been a straightforward transfer had already cost her something that couldn't be given back. Time.
Na nikiwa kwa ambulance hakuna matibabu yoyote nilipata. Juu alisema hawataniguza.
Cecilia walked to the hospital. She was pre-eclamptic. But by the time they were referring Cecilia to Mama Lucy Hospital, she was already eclamptic. If only at Embakasi they hadn't controlled the pressures of Cecilia, she would still wait up to term. But because there was a delay in management, it put Cecilia and the baby at risk.
Some facilities have sent babies who need oxygen, who needs to be on oxygen on transit. So all that way, the whole transit, the baby will lose oxygen because they need this. By the time they get here, yes, the baby is here, the baby is alive, but their interventions might not do much.
Cecilia's experience and that of thousands of mothers is now documented. A study tracking over 130,000 newborns across 13 Kenyan hospitals has put hard numbers to what health workers on the ground have long grappled with.
What our study found is that there were more deaths among babies who are born outside those health facilities, in other words, referred from other health facilities. And the ones who are referred from other facilities were at 3 times higher risk of dying, like 1 out of 3 actually died, compared to those who are born in the same health facility.
For many of these babies, the journey between facilities can be the difference between life and death.
The condition could change during transportation. On arrival at the health facility where this baby is being referred to, the triaging process or ensuring that the baby is seen as soon as possible should happen efficiently. If that doesn't happen, all those different factors could adversely affect that baby.
And by the time many of them arrive, the damage is already done.
Most of them would come with birth asphyxia, neonatal sepsis, prematurity. Those are the 3 main causes of their referral ins, mainly because the other facilities are not in a position to handle them.
Born too early, struggling to breathe, fighting infection. The research points to failures at every stage, before, during, and after the referral. Facilities that are not equipped to stabilize babies before they are transferred, to journeys made without oxygen, without trained personnel, and hospitals at the receiving end that are themselves overwhelmed.
In some cases, one nurse takes care of about 40 babies, especially at night. And you can imagine with the kind of babies, with the kind of clinical needs that we've been discussing here, being taken care of by one nurse among 40 other babies. That's clearly not the way things should be.
Professor Masheri and his team are calling for a shift in how Kenya manages its most vulnerable newborns, connecting lower-level facilities to specialist hospitals before a crisis becomes a catastrophe.
The thinking or the decision is actually to have that hub being very well equipped and very well staffed, so that complicated babies and even mothers, I must say, who are from level 2 and level 3 can be managed at level 4 where the hub is. And more specialized cases would then be the only ones which would find their way to the county referral levels, which would then help with the decongestion of our county referral facilities.
Now, here's the thing. In the time it takes to watch this story, the clock has moved closer to another preventable death. In Kenya, it happens every 15 minutes. This week in Nairobi, governments and global health leaders pledged to end it. The data is now on record. The solutions have been costed. What remains to be seen is whether the commitments made inside those conference halls translate into the staffing, the infrastructure, the referral systems, and the political will needed to keep the next baby alive. For the Frontiera Media Group, I am Anne Mawathe.